It is 1 o'clock and we can get started. So hi and welcome to Gearing Up for GGRF. This is a webinar where we wanted to show you a number of ways in which we thought that PolicyMap might be able to help organizations working with greenhouse gas reduction funds in neighborhoods across the US. Just in terms of some very light housekeeping, this is a go-to webinar, so everyone is muted at the moment, and if you have questions, and we really hope you do, please type them into the chat window in the go-to webinar. Phil Vu is going to be monitoring that chat for us. Similarly, if you have any technical problems during the course of this webinar, post them in there, and Phil will also get back to you. And then lastly, I wanted to add that as we go through this, if you think of or feel that there is data that you're going to need for your GGRF work, we would really love it if you would type that in the chat as well, because it is an area where we would like to continue our research. So we're not going to mind the Ring doorbell. We're not going to mind the dog that's barking in the background. We're just going to dive right in. And then at the end, I wanted to say that we are going to have a Q&A session, so we'll hold all the questions to the end. I am going to do my best to keep this to about 40 minutes. Phil, if I start to go over that, just give me the sign, and we will answer any questions at the end. And then, of course, if there's any questions that we don't get to during the course of the webinar, we will be sure and follow up with you after. So let's get started. So my name is Maggie McCullough. I am the CEO and founder of PolicyMap. And in this webinar, we're hoping to show you what we think are 5 unique ways that PolicyMap can help in GGRF activities. The first is targeting areas for priority investment based on not just one CGIST category, but multiple categories of CGIST burden and other neighborhood conditions to really take the world of census tracts that are considered burdened and narrow in to those where you really may want to think about investment. The second is to identify investment opportunities, and this can be done in one of 2 ways. One is looking at institutions that are already in the neighborhood that may, investment in those institutions may benefit the community, or uploading your own pipeline of opportunities and seeing which of your opportunities fall within these target areas. A third, because we know partnerships are going to be very important for the success of this program, is to actually find on-the-ground partners by locating nonprofits or other anchor institutions that are working in the target areas. Fourth is to really understand the neighborhood conditions of these areas. And the fifth is to track changes over time, because we know people want to see how the area around the investments are changing as a result of these investments. And so these are the 5 areas that I'm going to try and address. It's a lot, so bear with me, and I'm going to go into the application there. So this is the PolicyMap application. For those of you who are not familiar with us, we developed this analytics and mapping platform called PolicyMap while we were in the CDFI Reinvestment Fund. We were incubated there, and we spun off as a standalone benefit corporation, which is how we operate now. But our roots are very much in the CDFI world. We have set out, our mission is to curate as much public data as we can get our hands on, marry that with proprietary data that we license from third-party vendors, and put it in a single platform, this platform that you're looking at now, so that our users can understand really what's going on in the communities in which they work. The data is all available above the map in these tabs. So demographic data, data on incomes and spending, housing, and so on. All of this data works through clicks of a mouse. And so when you click on a layer and it chooses not to load because you're doing a webinar, there it goes. This is being a little slow. You can immediately see that we're looking at a map that is the estimated median income of a household. You can see in the legend that the darkest purple places on the map is where the median income of a household is $73,000 more, and those lightest purple places are places where the median income household is $49,000 or less. All of the data that's thematic data in PolicyMap works this way. It's available on a click through these menus. There's housing data, we have lending data, variety of quality of life indicators, information about the economics of a place, the kinds of jobs that people have, education, attainment, health conditions, and then most recently under federal guidelines, we loaded the EPA's Climate and Economic Justice Screening Tool data. So this is data that you can find just like this on the EPA's CGIS tool. These are disadvantaged communities. The EPA, as many of you know, consider these to be overburdened and underserved, and at least 40% of GGRF funds are supposed to be invested in these purple communities. These purple communities are the communities that EPA considers to be disadvantaged. And as many of you know, to be considered disadvantaged, a census tract must meet a socioeconomic threshold and meet one of 9 categories. And if you click on any of these, you can find out that this particular tract in the center of the country is disadvantaged. And the 9 categories of specific burden that EPA is looking at is climate change, housing, health, workforce development, water and wastewater, legacy pollution, energy, and transportation. And this particular census tract is disadvantaged on a number of categories: climate, water and waste, and transportation. And because of that, it gets the overall category of being disadvantaged. So you can click on these areas, zoom around, go to any part of the country. You can look not just at the overall burden, but just like in the CGIS tool, you could look at the individual categories and see those on a map by themselves. But what we think is important, and we wanted to share with you today, is what if you wanted to see specific areas that meet more than just one general indicator of disadvantage, and find those places that have potentially been most left behind, right? So instead of looking at one layer at a time on a map, find where certain burdens intersect, and perhaps think about those burdens in relation to the type of investment that an organization is making. So this is an area where PolicyMap can help. So hypothetically, right, if you have a housing investment, if you're going to be doing a housing investment program, perhaps targeting tracts where the housing conditions are a burden and poor health outcomes are a burden and legacy pollution is a burden. If you could find those tracts where those things intersect, maybe they become sort of a tier 1 set of priority areas if one of the goals is to help communities that have been most burdened by these factors. So if we go, and I need to move this here, okay. If we think about Pennsylvania, and I picked Pennsylvania both because we're located in Philadelphia, but Pennsylvania also has a good combination of urban and rural communities. But if we go and we look and we zoom in a bit, we can see we've got Philadelphia, Camden, and as we pan around, you can get into the more rural communities. I'm going to go into our multi-layer mapping tool. And I'm just going to look at, everything's purple now, but I'm just going to look at those tracts that are considered disadvantaged, right? So this is EPA's disadvantaged category. But as we've said, we're hypothetically thinking about a housing program, and we're thinking about maybe creating a tier 1 set of target areas that are going to address an intersection of burdens, because these are the communities that may be in need of intervention most. So let's look at these communities and those that are housing burdened. So if we go back, we click on housing, and we only want to see those that are also housing burdened, we see a fewer number of tracts, right? So these are also burdened because there's been historic disinvestment, or they're very burdened by housing costs or a lack of plumbing or green space. And we want to see where they're also facing health burdens. So we put this on and we select just to show where it's disadvantaged in health. And again, we have a slightly fewer set of census tracts. So these are now, they've got a housing burden and they have health-related burdens. They are higher rates of diabetes, heart disease, asthma, or low birth rate in these communities. And then lastly, we might want to look to see where they also have legacy pollution burden. And here we'll again select just the disadvantage for legacy. And now we have far fewer. So now, and we can click on any of these to see that, we are looking at census tracts that are disadvantaged on the legacy pollution category, they are disadvantaged on the health category, they are disadvantaged on the housing category. And so we have far fewer census tracts. And if we wanted to think about bringing in some more current data, obviously, I think everyone would love to be able to see where emissions are greatest. And we are looking for a source for that data, but we can look at where health conditions that are most related to high emissions exist. COPD is one of them. And we could look to see where we also have high rates of people with COPD. And so I'm going to suggest that we just want to look at census tracts where COPD rates are 10% or higher. So now you see we have gone from like a sea of disadvantaged tracts to a handful that all are facing these same problems. So you have some in Philadelphia. Unfortunately, the entire waterfront of Chester is still all purple. Much of the state is not facing this combination of things, but you can see here in Reading that Reading really is faced with this combination. So, you know, as we think about this hypothetical housing program and we think like, okay, this might be an interesting place to consider targeting, we can learn more about what's going on in Reading. One of the ways to do that is to change our base map to a satellite. This gives us a nice view of sort of what's happening on the ground. And we can see as we zoom in that there are areas that are residential, as well as areas that have much more industry attached. And circle P is just going to stop shortly. We can see that it is much more rural in this part of Pennsylvania. And the circle is going to stop in a minute and my map will come back. I can also go to my, here we go. Okay, so these are the resulting areas in Reading that met all of those conditions and could hypothetically be where we want to do a set of housing interventions. So as I said, you can switch to the satellite view to zoom around and get a better look at what is going in on the ground. We can go back to our regular map. And we can think about understanding more about what's going on in some of those places by running a quick report that will give us a good snapshot of life in that community. And if I click on this tract, which it's not shading right now because the purple is still thinking. There it is. Okay, so this tract, which is one of the areas that met all of the conditions, I can see why it met all of the conditions, and I can also run one of our reports, the community profile report, community health report, a rental housing report, a home mortgage report. The community health report gives a lot of information about the demographics in the place, the health conditions that it's facing, and so on. It loads, and it, as you can see, it has a population section, a healthcare access section, health behaviors, general health. It shows us the area that we're looking at on the map. And it is a very, very, very detailed report that tells us that the population is on the rise in this area. It tells us that the age of the population is working adults, as well as a good chunk is under the age of 18. How the race and ethnicity composition of the area is changing over time, the percentage of the population that is Hispanic or Latino, what their healthcare access looks like, health insurance. It is a medically underserved area. The kinds of disease screening and prevention that the people are receiving, physical and mental health well-being, the percentage of people with disabilities, 30.63% of the people who live there have a disability. It is higher than Berks County, and it's higher than Pennsylvania. The report goes on. It's chronic conditions, food insecurity, other social determinants of health. So it's a really great way to get a snapshot of what is going on in a place. And then as data changes, it is a place where you can start to track change as well. So if we go back to our map and we figure, you know, we've looked at the satellite view, we have looked at the reports for each of this area, and we say, you know what, this is definitely an area where we want to target our investments. We can very easily create a custom region to save this. And I'm not going to do it for block groups. I'm going to do it for census tracts. And you can just quickly select the census tracts that met the conditions, save it, and say that this is a priority GGRF area. And now you have this, and you can pull this up at any other place in PolicyMap. So I'm going to go back to our single layer, and I am going to take everything off of the map, except for our custom area. So this is the area, and if you recall, it has met multiple conditions of burden that we think might be helpful for a potential housing investment. And now we want to think about, all right, where might there be investment opportunities? So the first thing you can do is upload your own list, if you have it, of your pipeline, potential pipeline deals. And you can do that by using our data loader. So using the data loader, you would browse to find your list. I have a list of potential deals here. It needs to be in a CSV format. I'm going to call it potential deals in Reading, PA. I'm going to import my spreadsheet. Then it's going to ask me a series of questions, and it's going to geocode the spreadsheet. I'm not going to walk us through that right now, but it will geocode the spreadsheet, and then you'll be able to go to your My Data tab and pull up the list of properties that have now been geocoded. So they're coming in as an orange triangle. I'm going to change that and make them a different color so they stand out from my custom region. But you can see that you have a pipeline of deals, and that a handful of them do fall into this target area. And if you click on one, any information that you have about that potential investment, this is just a dummy data set that I made up, would appear in this info bubble. So that's one way to find potential investments that sit within this target area. Another is to think, are there already existing institutions on the ground that with an investment might benefit the community. And so if this is a potential housing investment, we can think about things like HUD multifamily, low-income housing tax credit deals, and you can start to see where those deals are located and know that an investment in one of these locations could potentially benefit the community well. So River Oak is a low-income housing tax credit deal. You can click on the project details, get some more information about it. You could click on all of the points in this way. You could also put the labels on so you could see them a little more clearly, the HUD multifamily. So you have a number of housing developments in the area where some investment on that property could benefit not just the residents of River Oak or Abraham Lincoln Court, but the surrounding neighborhood. And you have some to the outside here, but there's quite a few on the inside as well. A third thing that you can look for is places where there is opportunity for partnership. So we have in PolicyMap all of the nonprofit locations from a company called Candid. So you can put those on the map. They're going to appear as orange squares. There's many of them. And each of these may be an opportunity for a partnership as you put together a group that's going to think about strategy in a particular area. You can also filter the nonprofits and say, because this is a housing program, I really want to look at nonprofits that are focused on housing. And now you have a subset and they're appearing as orange squares. So right outside, you can see that the Pennsylvania Home Lending Collaborative sits right outside of this target area, and Habitat for Humanity sits inside. So these could be two organizations that you want to talk to about, investment in that area. There's also one up here, Hope Rescue Missions of the City of Reading. All of these can be downloaded, right? So once you have those points and you click download data, you can see I can download the nonprofits that are in the area, the low-income housing tax credits, properties, the HUD multifamily, and my own potential deals. I can download them, have them emailed to me for further research. And any points, you could put public housing points on, you could put schools, you could put universities, you could put hospitals, you could put healthcare centers. All of that data is available in PolicyMap, all in those menus up at the top. And of course, we know that people will always want to know more and more about the information in the areas in which they're making investments. And so you can, from here, again, this is a hypothetical housing program, you could think about mortgage origination data or what rents are. So if we go under lending, we could look to see mortgage loans, all mortgage originations, and we can see in this target area, this is the median dollar amount of home loans in 2022. And so we can see that definitely the Reading area is the lighter purple. So these are where the median dollar amount of a home loan is less than 165. And as we mouse over, we can see what the actual values are. Some of the higher priced areas sit outside and to the west of the city of Reading. You could also be interested in what rents were like. So if we look under the housing tab, we can look to see rents and see the median rent in these places, and be able to see that, okay, this area has a higher median rent at $1,391, and then these are the lower rent areas as we mouse over our target area. You can similarly look at, we can pan all the way down to Philadelphia, because the same, when you load it on for one area, it's happening for the rest of the country as well. So we can see, in Philadelphia where all of those same conditions exist. So we also know that people are going to be wanting to track, type in Reading here, back, to track how places are changing over time. And as I said before, we are really interested in finding emissions data because we think that will be helpful in this work. But people can look at things like asthma as a proxy for emissions to see how, say, asthma rates are changing over time. So if we look at asthma rates, we put that on, we can see in that orange area that we have high rates of asthma, 13, 12%. And if we click on them, we can see how the asthma rates are changing over time. So in 2019, it was 12%. Looked like it went down to about 11.9 in 2020, and now we've shot back up to 2021. And so that seems to be the case in just about every part of this area in Reading. So yeah, if we sum it up here, the idea was, and I'll put that custom region back on, but the goal was to consider not just what EPA has thought about in terms of burden, which is that really the place has to meet a socioeconomic condition and one category of burden, but based on the type of intervention that we're thinking about in a community, thinking about places that meet that socioeconomic condition, obviously, but then have a number of burdens that they're facing, burdens that we want to address through our intervention. To really set a priority set of target areas for intervention. And so we know this has been truly hypothetical, as organizations are really just now trying to figure out how funds will be deployed. But I hope it provides an example of how PolicyMap and the ways it can help you look at multiple indicators at one time can help with creating a strategy, deploying it, and then assessment over time. And I think I probably spoke faster than I had planned to. There are any number, sets of data in here related to health facilities, as I mentioned before. If you have investments where you think investments in hospitals or nursing facilities or retail-based health clinics or community healthcare center lookalikes might be helpful, you'll find those institutions in your target area as well. The demographics will give you a lot of information about how the population is changing. You can get it from the reports, but then also from looking at individual maps, the foreign-born population, the language that is spoken at home. We can look at predominant languages, and when you can see this like really lights up, the predominant language in all of this target area is Spanish or Spanish Creole, so it's incredibly important to know that for any, obviously, program or investment that's going to go into the neighborhood. It is obviously distinct from the surrounding more rural counties in which it sits. So we have information on, again, the incomes and spending, federal tax returns, where people are spending their money, consumer spending habits, affordability, food and nutrition. The housing is a very robust sets of data. We can see the vacancy rate if we wanted to look at how vacant residential properties might be impacting our target area. And if we zoom in, this does shade at a block group for us. So we can see that there are higher vacancy rates in parts of this target area. So vacancy will be something that the community is talking about and something that, an intervention, in addition to being, trying to help some of these developments become not so reliant on, gas or fuel to heat, but maybe that there is a vacancy issue that needs to be addressed as well. So I've taken about 30 minutes of the time instead of the 40 that I had been anticipating. Phil, I don't know if anybody has any questions or any other scenarios that I might be able to show people.
Yeah, just so some really good questions about quality of the housing stock, including things like age of home and heating types, cooling systems.
Yep. So we do have housing. We do have all those things, and I'm just looking for them. So when you can't find them in the menus, that's why the data search bar is really important. So
it's under residential buildings and quality of housing.
Okay, great.
Age of home.
So
and
we
then
have age of home. So we have median year built, and we also have pre-1940, pre-1980. So we could look at median year built first. And as we move over, so this should be a year that's displaying for a median year built. But this is, these are older housing stock here, 1938. This is newer with 1975, 1977. And we have under housing and
housing quality,
plumbing and facilities,
heating fuels,
home heating type. So we can see utility gas, electric, oil and kerosene. It's a lot of oil and kerosene up here. So like 43.81% of folks in that block group use oil or kerosene. 31.39% here. 6% there. It varies a bit, but you do have some blockers, particularly up here where there's a lot. And over here, 25%. So the darker the purple on the map, and I can just singular that out. These are the places where more than 16% of households are using oil or kerosene to heat their home.
And then another really good question from Anthony regarding the vintages of information being drawn for 2010 census as well as 2022 census and data.
Yes. So we have all of the vintages in PolicyMap. And you can work with them together in PolicyMap. So I believe the CGIS data is out at the 2010 vintage of census boundaries. And you can look at it though. So you can look at it in comparison to data that's coming in at a different vintage. So if we look at disadvantaged communities, these are all disadvantaged communities. This is mapping at a census tract for 2010. If we look at more current data, like population, that's going to be mapping at a 2022 boundary. But you can do both on PolicyMap, and when you're in multi-layer maps, you can still use both vintage types. So you can, look at CGIS data in comparison to data that's either coming in at another vintage type or even another geography, like a zip code or a county. Does that answer the question?
I believe so. And I think that's, and everything else is just general questions that we were able to answer. Yes.
Okay. Is there any data that people are suggesting that they would like to see us have that we don't have at this time?
Not yet, but if you type it into the control panel, we'll read it.
Okay. One of the things when I was preparing this demo that I thought was fascinating was if you go to, I'm just going to take it to Philadelphia. And we do what we did before, and we put these, let me go into multi-layer maps. it'll apply those again. And we look at the places that are, it's the same set of conditions that we had in Reading. It exists here along the waterfront in Chester. And when you take it into a satellite view and zoom in, you can really see how these neighborhoods sit along very, very industrial parts of the riverfront. And we do have in PolicyMap electric generating plants. Electric generating plants are the I think electric generating plants are the #1 cause of emissions in the United States because they burn fossil fuel in order to make electricity. And so I guess I shouldn't have been surprised at how many electric generating plants sat along the river, and that of course it's these neighborhoods that would be most affected by emissions and health issues. So that is another data set that we have.
Good question, good one. There was a really good suggestion regarding boundary layers for utilities, co-ops, and municipalities, which we do have a little bit of city, but we don't have.
Yeah, we have in this boundaries menu, let me turn this off. In this boundaries menu, you can see all of the boundaries that we have in PolicyMap. So metro areas, metro divisions, and we have all the different vintages going back to 2000. Zip codes, blockers, congressional to upper districts, school districts, hospital, what was the specific one, Phil?
Municipalities, co-ops, and utilities.
Yeah, so we do not have utilities. We do not have co-ops, but municipalities would be cities, perhaps?
Yeah.
Yeah.
A good question regarding, do we have data covering health inequalities?
So we have health conditions data. So where you have any kind of chronic condition, infectious disease, cancer, disability, perceived health status. We have risk factors. I don't know that we have any specific
possibly related to the social determinants of health. The curated data set for it.
So we have social determinants of health by race and ethnicity, and by age. So we could look at access to healthcare, uninsured Black population. So it's the estimated percent of Black or African American people without health insurance between 2018 and 2022. So the darkest areas, again, are where you have the highest rates of Black or African American people without health insurance.
Awesome.
So that curated collection will provide a lot of breakdowns by race and ethnicity and by age across mortality, access to healthcare, infrastructure and built environment, community social context, education, and financial stability.
Awesome. And then another really good question is related to transportation deserts. What sustainable modes transportation are frequently in a region? So I know we have transit lines and stops.
We do have transit lines and stops. So we have rail lines and stations, and we have bus routes, which appear like this on the map. So you can see the stops. So on this route, you can see the names of the stops. Sorry. So yes, we do have these. And then one of the CGIST indicators is related to transportation. So it might be interesting to put that on top. So anything that's yellow on our map, it is not transportation disadvantaged, but anything that is purple is. So it is showing, you know, once again, some of these places in Chester, they're showing as transportation disadvantaged. That means you can always click on the eye. When you're looking at a layer on the map, in PolicyMap, you can always click on the eye to get more information. These are census tracts that are at or above 90th percentile for diesel particulate matter exposure or transportation barriers or traffic proximity and volume. And they're above the 65th percentile for low income.
Perfect. And then just some really good questions regarding how frequently the data is updated, and then can the maps be shared across organizations within a subscription type model?
Okay, so the data is updated. Our goal is when the data is updated by the source, that we will have it updated and in PolicyMap within 6 weeks of it being updated. So that is our goal. Many of the public data sets are updated annually. Some are updated quarterly, but there are many that are updated annually. Some of the private data, so I believe the nonprofit locations get updated more than annually. Vacancy data from Velasas gets updated quarterly. We do have home sale data that we get from a private vendor, and that's also updated quarterly. So it depends on the data set. And then again, our goal is from the release of the data, it would be 6 weeks. And then yes, depending on the kind of subscription or access that you have to PolicyMap, you can save your work, anything, a custom region, a map that you made, a report that you've generated, you can save it and you can share it within your team.
All right, great. Any other questions? Let us know. Some great ones that came in. Well, thank you very much. I mean, I hope this was valuable. We'll probably do this again as things get closer and get moving, and I think we all have a better understanding how organizations are going to be deploying capital and what that process is going to look like. So yeah, we look forward to having this conversation one more time with you, at least. And then any questions that we did not answer, just know we would definitely follow up with you and answer directly as well.
Mm-hmm. Great. And again, if there's any data that you can think of that you might need for your work, we would really appreciate hearing about it so that we can explore it ourselves. Well, thank you. That was a much shorter demo than when I had planned it, but I'm glad to be able to give everybody back 15 minutes in their day. So thank you very much.